All right. Hi again, everyone. My name is Beth O'Riordan. I lead commercial content marketing here at Best Buy Health. Thanks so much for joining today's webinar, From Optional to Essential, How Technology is Becoming a Core Aspect in Senior Living Communities. So we have a great panel for you today, which will be moderated by Best Buy Health's Director of Senior Living Growth, Amanda Moleche. Before I hand things over to her to kick things off and introduce our wonderful panelists, Chris and Lauren, I want to do a few housekeeping items. So first, we will be taking audience questions at the end of the webinar. So feel free to type in your questions at any time during the discussion in that Q&A box that's on your screen, and we'll get to as many questions as time allows at the end. Next, we will be recording today's session, and we will distribute that recording in the next few days, so please look out for that. And then lastly, if you have a minute after today's webinar, there will be a post-webinar survey that will pop up on your screen. We appreciate your feedback. We read everything that you guys submit to us. So if you have a minute and can take that survey, that'd be great. And with that, I'm going to hand things over to Amanda to kick things off.
Thank you, Beth. So to get us started today, can Chris and Lauren, can each of you briefly introduce yourselves, your organizations, and share a little bit about how you're using technology today to support residents, family, and staff?
I can go first. My name is Chris Snall. I'm the CTO of Atria Senior Living. We support over 205 communities, about 25,000 residents, anywhere from the CRM upfront of engaging residents to move in our communities, to personalizing their experience, to the interactions they have with our Wi-Fi technology and engagement technology.
Great.
I'll turn it over to Lauren.
Yes, awesome. Thank you, Chris. I'm Lauren Horn, Director of Wellness Integration at Arrow Senior Living. Thank you so much for allowing me to be a part of this panel. I think this is a really exciting topic and probably some of the same reasons why I came to Arrow. So Arrow manages just under 50 communities today, and I say today because we're ever growing. But we started with our CEO, Stephanie Harris, and that passion and that vision, like how do we not only envelop what senior living is, but really drive it like a data-driven business. So we look for that transparency and the real outcomes. And so I'm excited to be here today, and we'll get to talk about how we use technology. So thank you again.
Awesome. Thank you both. So when you think about your organization's technology journey over the last few years, what would you say has been the most significant change in how you view the role of technology in senior living? Chris, we'll go ahead and start with you.
Thank you, Amanda. I think the most significant is the expectations that residents have now moving in. This is a generation that transitioned to smartphones. They have much more familiarity with sensor technology, video conferencing, and having that infrastructure in place before they get to our communities. Senior living is playing catch up. We're about 15, 20 years behind the hospitality industry. So that's probably one of the biggest things. The second one being the personalization of starting to group residents together by, they come from a similar geographic area, similar military branch, religion, and knowing that when they come in, so you're giving them a hospitality-like experience to age in a communal setting.
How about for you, Lauren?
Yeah, absolutely. I think several years ago, we were looking at which platform is going to give us that best fall detection, and which one's going to do whatever that feature was. And today we're really looking at that 360 view, what gives us that true view of our residents and our operations. And I think, it's a little bit more than a few years ago, thankfully, but COVID really kind of switched that for us when our families couldn't come into our communities. We had to use technology as that trust bridge. Like, how do we give residents, family that information that feels proactive and not just reactive to what's going on? So I think that really changed how we view technology, how we have that relationship with all the technology we use, and just what we expect out of our vendors that bring that technology to us.
Of course. So technology is increasingly being described as foundational rather than supportive in senior living. What does this shift look like in practice within your organization, and how has it changed different leadership priorities? Chris?
You can't do a technology presentation without talking about AI. We at HR we invested a lot in the foundational data layer over years. We're really starting to try to transition those insights for our executives, our general managers of communities, so that it's actionable. It saves labor from the sense of we're not expecting people to be analysts. We're giving them the exceptions. I love the way Lauren phrased it, that 360 view of the resident. With what we have now in 2026, we can absolutely anticipate needs. We can anticipate risks, and I think that's been the leadership shift, is really embracing the data aspect and the predictive data aspect for our residents.
Yeah.
How about for you, Lauren? Sorry.
No, that's great. I couldn't agree more. I think we can't look at it from our budget standpoint of what can we afford. What we do at Arrow is say, what do we need to know about our residents? What do we need to know about our operations? And how can we see that? And so how does that show up in how do we make that foundational? And so we kind of built our own scorecards of bringing all of that technology in. So it's right in front of them, and that's the foundation of it. When people see that data, they see it across the communities, across their departments, and being able to say, technology is just how we're delivering it to them, but being able to, we don't drive without looking at our dashboard in front of us, how fast we're going, how much gas we have. So thinking about it in that respect, if we have that full view of how we're operating and how we're using it, it just changes the whole tone of it.
Yeah, and this is a bit of an expansion on that, Lauren, but if you could expand a little bit and just share a little bit further about what role data is playing in informing technology decisions and provide a specific example for us.
Yes, absolutely. I think we have to look at the data. We don't start with what are the features list of a technology. Again, what is that technology going to surface? What kind of insights is it going to give to us? What else is it going to integrate in? We were talking about that 360 view is so important. And if it's not part of that loop and that circle that we already have, it doesn't matter how great the technology is or how good the demo looked or how shiny of a package it comes in. And I think about that across several of our monitoring platforms, and the technology itself wasn't really the deciding factor. It is the data insights that we can bring all together and how we can just help our care team get to the resident and exactly what they need, and not just have a snapshot.
Okay. Do you find that residents and families are arriving with higher digital expectations? And what expectations are you seeing the most often today that maybe weren't on your radar 5 years ago? Chris?
Absolutely, Amanda. I think previously resident experiences, the baseline was cable TV. Now when our residents move in, it's a hospitality like view on their TV. It shows the weather, it shows activities, it gives them community information. And this is a big shift from what we had before, where we weren't as necessarily invested in like the in-room experience. It's table stakes right now to have high-speed Wi-Fi, but it's the high-speed Wi-Fi to pair with their Alexas, to pair with their Best Buy Lively device that is kind of the elevating that experience. And these residents, they know how to use smartphones, they know how to use tablets. They want that connection and the ability to have that elevated experience once they move into our community.
How about for you, Lauren?
Yeah, I think several years ago, the questions that we get most often is, will mom be safe when she moves in? And it's shifted, and it's more of like how will I know that mom's safe? And I think that comes from this generation that's driving these move-in decisions. The residents themselves, they've run businesses looking at dashboards all day long, and they come to us expecting that same from us. Like, how do you have the proof behind it of what's actually going on. So they want to see that evidence. They're used to seeing it in everything else that they're doing, and so we have to evolve with that. Going back to what Chris said, we were so far behind, and we didn't focus on how everybody else in other industries knew specifically their customers. And so I think we've evolved to that today.
Great. How do you balance the idea of innovation with the need to keep technology simple and accessible for older adults to use? What would you say, Chris?
One best practice that I'm free to share is when we come in and do like a big Wi-Fi projects are the most complicated ones that we do because you touch 125 rooms. That's 125 plus their adult daughters, their adult sons, and their grandkids. So we spend a lot of time up front on selling in the solution, more than I've ever done at other companies, and as well as having like a technology concierge on site to get to onboard them. And I think the onboarding aspect is what's really unique in senior living. Hotels don't have to do it, cruise ships don't have to do it, but we really have to onboard them to the solution with a tech concierge. And then we build in with our engaged life team activities of, okay, here's things you can search on the internet. Here's how to use an AI tool. And then we also try to marry that with protections for seniors because it is a vulnerable part of our population that unfortunately people take advantage of. So we try to pair that throughout the year with different activities that we're having just to keep them engaged in some of the investments we put in the communities.
Great, thank you. Lauren, do you have anything to add from your perspective?
Yeah, I mean, I think you said it perfectly. I guess the only thing really I could add to that is that when we look at our technology, the majority of it is we're not asking our residents to do anything differently. It's just there on their behalf. So ambient monitoring and fall detection and even acuity tracking, there's no learning curve. So the apps that they can or the technology that they are interacting in is the ones that they're used to today. How do I order the food that I want, and how to my community app, and how do I communicate? So that's very zero learning curve for them.
Of course. Many senior living operators are dealing with a patchwork of different systems that don't always communicate well with one another. What have been the biggest challenges of fragmentation, and where have you seen the greatest benefits from creating a more connected technology ecosystem? How about for you, Lauren?
Oh, I do love this question because at Arrow we really built our own system because we had 30 systems, and of course everybody loves their technology, and they did have great technology, but we couldn't be going into 30 different dashboards and trying to figure out what's going on here. The insight wasn't in one system. It was kind of the space in between there, and none of them were talking together. It'd be like trying to diagnose someone's disease when you have 5 different doctors and they have one page of the chart and they're not talking together. So I think what's so important there is the moment we built a system where we could bring in that data and it could start to give those insights together, and then push that to our clinical team. It not only saved time, but like we just found things that we were genuinely missing. So it wasn't like we had broken systems. We were just able to put on a pair of glasses that took the blurriness and where the lines weren't connecting and put them together for us.
Great. Chris, can you talk about the foundational investments and how important that is when you do want to implement something new at your organization?
Um, Absolutely. So one thing that we really do is it's not necessarily selling not just the residents, but we have to make sure the culinary team is bought in on it, the operations team locally, because it is a new thing that they have to support. So we try to sell that to the staff with, okay, this is how it's going to make your job easier. Instead of manual check-ins with each room, we're going to use sensor data. We're going to use key card data. We can even tell when they turn the TV on and off. And that's the sharpest. I tell my team a lot. We're the assist. We're not necessarily the point guard. The point guard's our ops team interacting with the residents, but we're getting the rebounds where we're investing in the right systems. We've got our own dashboards monitoring uptime, because the worst thing that can happen with a technology implementation is constant outages, instability. It doesn't sell it out. So a lot of those I'll personally go on site just to keep supporting the teams of okay, this trust us. There's a little bit of pain every time these go in. However, it's enabling A, B, C, D for the community, and it's setting us up for the next 10 to 15 years from a technology perspective.
Of course. Lauren, if you could eliminate one technology pain point for your staff tomorrow, what would it be, and why do you think it would make such a difference?
Oh gosh, I'm coming from the nursing world, but I love the technology world, but I also understand that if I could pick one thing, and there's so many that I would go with, but it would just be the usability and the documentation piece of it. I think everybody that comes into senior living is coming here to care for individuals. We don't want to spend the majority of our time trying to be compliant with here and log in here and log this and trying to make that connections happen. So I think it's just so important to have it integrate, make it user friendly and documentation. So I know that's three, but they're all intertwined together there.
Yes. Chris, as organizations evaluate new technology, how are you measuring success beyond just that implementation that you spoke about? What outcomes matter most to the residents, families, staff, and operators from your perspective?
From a resident and community perspective, it's definitely extending length of stay. That's a common barometer that we have, whether it's 30 days, 60, 90. It's kind of a sad number of how many people move out within the first 90 days. So we try to use these digital touch points and then feed those insights to the care staff, to the culinary staff, to make sure they're making the right dinner for mom and dad that they like. They are spending time. So we're really using those interaction data is a big outcome. And one of our biggest pieces is ROI. The other piece is connect. When we do introduce a new piece of technology, trying to eliminate two other pieces from the community, just to keep, what Lauren said, our care staff, they're not technologists, they're not analysts, but they know how to interpret conditions that some of the humans have in our communities. So the easier that we can get the information and the way they prefer to receive it is where we start to get those wins and those ROIs. And the way we measure that is we do twice a year staff feedback, and we ask them certain technology questions to make sure we're not introducing new friction, because it's already difficult enough to go through the hiring process to get people in. We don't want them to have take a step down when they come into work with the tools that we give them.
Of course. How can you embed technologies in ways that feel seamless rather than intrusive, Chris?
I'll give you an example. So the background here I have is we have two coterie communities there in New York and San Francisco, and we actually are pulling data off of the door locks when people badge into the room. We have Alexas in the room that tell us the interactions per day. So this passive monitoring, it's not as intrusive. It's something the residents, they're coming to age in place with that safety aspect. And we want to start to pull more of this sensor technology into getting that 360 view of the resident. And when there is a drop off in their interaction data, that's when we need to prompt staff to be more proactive with reaching out to the resident, making sure their physical and mental condition is going at the pace that they're expecting and their family members are expecting.
Yeah, that's great. I'd love to hear from each of you if you could share an example where technology directly improved a resident's quality of life, strengthened trust and transparency with families, or eased the burden of staff. You want to get us started, Chris?
Yes. One in particular, I know Best Buy is sponsoring this, but we have Best Buy Lively devices implemented on the independent living side. And the personalization of that support, they can hit a simple button, no need to call anybody. it goes to a 911 based call center 24/7. They can carry the device with them. And it's really given us the ability to, fill that gap where we typically don't have as much staff in an independent living building. And that's been a huge win, because then we can also see, maybe there are certain residents that use it more than we expected them at the independent living, and we can start to prompt, the resident or their loved one, hey, they may need a little bit more care, or, mom's, been reaching out for a lot of, companionship. They're hitting their button, talking to somebody, and those insights, sharing them with the family, have been very well received.
That's great. How about for you, Lauren?
Yeah, I think very similar. We use Best Buy Health and IL and different technology in assisted living and memory care, and that's so important that it doesn't have to look the same for every resident. So for our independent living residents, they're getting that peace of mind, but not having that intrusiveness or feeling clinical, and that's where they're saying like, oh, this really feels like I am in independent living, versus going somewhere else and you have the same thing that's on, in a nursing home, or something like that. That's what they're thinking. So I think that's the biggest piece for us. But having that technology, having those insights across all of our levels allows for our residents to move through their path, and the technology moves with them. So it might be different in assisted living, but it's that same philosophy. So how do we be seamless? How do we be not intrusive? But someone that might need a little bit more clinical oversight, we have the technology that might tell us they're declining a little bit earlier. And so we get those phone calls from the daughters that say, for the first time in years, I didn't feel like I was waiting for just the bad phone call to come in. So I think, integrating those systems and just across there, we went from probably just operating within snapshots, and now we get to watch a movie. We get to see the trajectory as they move through the path, and we have millions of success stories that they all get to say, just having that peace of mind.
Yeah. As you monitor technologies becoming more sophisticated, thinking about like ambient monitoring, how do you navigate the balance between safety, independence, dignity, and privacy? We'll start with you, Lauren.
Yeah, I mean, that's so important. I think it's not a policy checkbox. It is, dignity isn't something that we can say, oh, we checked off the consent form and now we can move on. It's that continuing conversation. And it looks different for everyone. But, for example, in all of our apartments, we have other things in there, smoke detectors. They don't have to go in and check in with it every morning, but it's there when they need it. Same thing for, Best Buy Health or any other technology that we have. And we lead with that. What does it give back to them? Same thing that we're looking for as we bring technology in. What are they looking for as they're coming into our community? So if that technology can give them that independence or earlier detection, or just allow them to stay there longer, it's the difference between a lifeguard watching you in a pool versus someone filming you. Very different experience. We want to just be that lifeguard or that safety net. People don't want to go to the hospital, so how they can get on board with that. Just having that net there doesn't mean that they can't walk like they normally would. They can't do what they would normally do. It's not like we shorten their leash to say you can't do this anymore, but we're there when they need it. And I think that's what dignity really feels like.
That's great. Chris, what has been resident reaction to some of these more advanced technologies? What have you learned about driving the willingness and engagement among the residents, but also families and staff?
The one of the bigger things we've done in the last few years is start to introduce Amazon Alexas not only throughout the community, but physically in the room. And we found the voice technology seems to be the simplest. There's no touch screens. There's no training. It's we've tried to make it as simple on the rollout as just plug it in. They're pre-configured to jump on our secure wireless network. And that's really given our residents a great ability to, not only reconnect with, the typical Alexa features with music, news, watching shows, but they're also able to call their loved ones just by using their voice. They don't have to find a cell phone or use an old touch tone phone. It's really taken that friction out of it. In addition, we've started to put our activities in there, so you can easily ask Alexa what activities are today, or Alexa, what is for breakfast? And it's so simple. The backend's complicated with the way we're modifying the data, but it's been a nice win. When we first introduced them, we saw almost a 50% increase in participation activities just by informing residents differently. There's still or paper dailies handing out, but we were finding they like that. They can easily use it, and when their grandkids come in, it's something they have fun with and can kind of show out, hey, I picked up this new skill set using an Alexa device.
Yeah, that's great insight. Thank you for sharing. Lauren, how do you provide ongoing education and support around technology in your communities? Who is a part of that program success?
Yeah, I loved hearing all of that you're doing, Chris, as well. But talking about the education, it's not optional, and it's part of that investment that we have to make. If we want the technology to deliver on something, we have to keep that ongoing. So we don't think of it as a one-time training or even education, because we have those dashboards, those scoreboards, everything up there. It's a daily conversation. It's a weekly, or even sometimes maybe monthly. But I think it's like, really, how are we looking at the outcomes of it, and what do we talk through as they're living it? Because if you just train even just one time, or train just a couple times, you might not be hitting the pieces that they really need. So I think that's so pivotal to just make it a part of what you're doing, make it a part of the conversations, and how can we really help them in what they need.
Great. Each of you touched on this briefly earlier, but I'd love to kind of hear a bit more about how you are currently partnering with Best Buy Health and what results that partnership is really driving. Chris, you want to get us started?
Absolutely. We've been a partner for all 5 of my years at Atria, but several years before on the IL side. And Best Buy Health's been able to give us timely insights into not only usage of the technology, but reason codes. It helps us scale our staff, where we that was the biggest struggle, like coming out of the pandemic, was bringing staff back into senior living. It was definitely one of our biggest challenges for the first 2 years. But using Best Buy Health, the multiple contact centers throughout the US, you really get trained people to help you fill in that gap. The other piece of it is also like peace of mind for the family and loved ones. I have aging parents. They can forget their phones. They forget, and the devices are so simple. They're on a Verizon network, which is extremely stable, and that peace of mind is really helped us start to regain occupancy on the independent living side.
That's great. How about for you, Lauren?
Yeah, absolutely. I think when we started with Best Buy Health, we were using the typical technology that we were using in assisted living prior, and I think Best Buy, you guys were really able to bring us in something that might not be able to replicate with other technology. So how do the residents and the families have that peace of mind and kind of that consumer grade tech experience? But then we still have some oversight of what's going on and what they do need when we need to be involved, or when we need to step in. So it's just part of our total community ecosystem that we have when we talk about technology. And I just love how we're continuing that partnership, and it kind of seamlessly came in with what we've been doing with technology for over a decade. It gave us another complete picture of the resident. Families felt better when they knew that they had this, and just gave them, again, like Chris said, the the peace of mind. And we're watching our baselines. Where are we, and what's it changing for us?
Wonderful. Looking ahead, how do you envision Best Buy Health helping your organization address some of their biggest challenges, whether that's workforce pressures, family engagement, or referrals? What does that look like for you, Chris?
I think the co-marketing opportunities on the front end, because it is, people are really familiar with the brand. They've gone to the brand for decades. Bringing that, that confidence that, hey, we've picked a strong partner that has solved technology needs for not only the common human, but also, that was people's go-to location for technology to bring into their house. I think having that co-branding helps on the sales side, and then the reliability of the network. This isn't a DIY independent living safety device. This is a big, global company that, cares. And, I love how much Best Buy's invested in this, because it truly is like the next phase of the population that we're bringing in our communities that we want to continue to build confidence around.
Absolutely. How about for you, Lauren?
Yes, I completely agree. And you were asking the question, he's talking. I'm like, it's all the way around. So for our care staff, just taking that burden of like, I'm responding to all of these residents, and knowing that they're still getting the care and what they need when they need it. So kind of taking that burnout, but the family and the trust. And when you said referrals, I mean, we all know senior living is so heavily word of mouth and what families are saying. And for them to come in and go, I just felt like I really was at home, but I feel connected and I know they're going to be safe. They just become our biggest advocates. And that's something that we have to keep striving towards in senior living.
Of course. When you think about the future of age tech, what technologies do you believe will become standard across senior living communities in the next decade? And kind of what makes you most excited about the future of technology in your community?
I can take that first. I really think, I mean, I know it seems futuristic, but I think robotics is going to get there. The price point, we're already investigating opportunities with self-cleaning robots. We're, there's plenty of delivery robots, but I think it's going to make the leap. I'm hopeful they're learning all the lessons from hotels and hospitality that we can partake in from senior living. I think that's the next step, because there is this generational workforce challenge that's coming up. There's not going to be enough humans to work, so we have to lean in hard to using the sensor technology, using robotics, and getting everybody comfortable with that. I know contact centers, were taboo, 20 years ago, but that's a way companies have scaled up and really given them the ability to continue to offer the similar amount of service, just with a different model. And I think those will continue. And the more we can lean into it, the more prepared we'll be for, the continued influx of new residents.
That's wonderful. How about for you, Lauren?
Yeah. I'll go back to the documentation. I mean, it has to be that AI driven documentation, because we have the AI, we have the insights, we're pushing it there, but then how do we close the loop on the other side? So how do we make those recommendations still within safety, and then communicate that out to the families? How do they know what we know at that point?
Yeah. As Chris had mentioned earlier, it's important at some point that AI, of course, is going to be brought up. So what role will AI and ambient monitoring play in enabling a more proactive and personalized care? And what safeguards kind of have to be in place to ensure that your communities and the residents that we serve have trust?
Yeah, you want to go ahead, Warren?
No, you go right ahead.
All right. I think it's starting to build this. I really view AI as a new professional skill. We've got chefs using AI to plan, meals. We've got, the ability to translate it into actionable insights is starting to turn more people into analysts that don't have that technical background or operational background. So I really do think the AI is going to make us smarter, faster, it's going to generate the insights that we need to refine our operations in ways that we just did not have either the expertise or the know-how to use the tools. It's something that we've got multiple pilots going on, but it's also like we've got strong buy-in because people are using it in their personal life and they want to come into work and use the similar tools, whether it's Copilot, Gemini, or Claude in the work environment. So it's definitely been a massive assist leader for us on the HR side.
Great. How about for you, Lauren?
Yeah, I mean, AI just does the math that we can't do. When we have so many communities, so many residents, and they all have their own data, we just we can't take all of that in, but we're still getting to make the call. The nurses still get to make the call. So that's kind of the safeguards. We have to be transparent about why AI is recommending something and have that kind of override when we need to, and be able to step back and look and say, is this AI assisted care? Is it really doing what we want it to do? Is it reducing my hospitalizations? Is it reducing my falls? And if it's not, I think we have to be able to willingly look at it and say, okay, what do we need to get there? Because that's where we ultimately need to be.
Yes. I'd love to kind of round up this webinar with this last question of what excites each of you the most about the future of technology in your communities? Lauren, I can see that you're thinking. Let's go ahead and get started with you.
Yeah, I think what excites me most is that when we have families that come into our communities, they are looking for us to know that we're going to take care of them, and we're making that promise. And now we have the tools that not only can help us deliver that promise, but we can also check and make sure that we are doing that and kind of be held accountable for that. And so giving us that complete picture, I think, senior living definitely different from years ago. At its best, it's like one of the most meaningful environments you can be in. And if technology is done right, it gives that access to so many more people. And we can actually deliver on the promise that we say, and they don't have to decide, do I want care or do I want everything else?
Of course. How about for you, Chris?
I think the thing I'm most excited about is CTO is really the pull aspect of it. When I say pull, residents are getting excited about technology. We're not having to do this, large financial sell to get the investments into the community. They're seeing what others have on the executive side. My multiple business partners that I work with, they want this, and the support that we're getting with projects in the past that were that's very, very expensive. They see the futuristic aspect of it. And then the other thing we're doing, I talked about our Alexas. We've got digital signs with the same information throughout the whole building. We actually mirror that for the loved ones, so they can see the activities, they can see the meals. It's not a true family app. We didn't have the most success with a family app, but it's giving them the same information so that when they have that conversation with mom and dad, they've gotten the same information from our engagement platform of what activities are today, who attended those activities, and they can have they can help us help their loved one when they're in the community of like attendance, meals, getting out of the community. So it's been a great from a technologist perspective. You're not selling a lot of these harder things now. Like people want them, they expect them, and it's been an awesome change.
That's wonderful. Beth, I'd love to kind of turn it back over to you to see if there are some questions from the audience that we could help to address.
Yeah, thank you. Thank you, Amanda. Thank you, Chris. Thank you, Lauren. We have about 7, 8 minutes. We'll get through as many questions from the audience as we can. Keep them coming, and if we don't get to them live, we will follow up with you. So the first question, Lauren and Chris, I wonder if you could both weigh in here. It says, can you please dive a little deeper on the ROI topic? What does real ROI look like when you're looking at technology?
I can take that one. I think ROI, and especially anybody working on a technology solution, they need to really break it down to the per room cost. Our CRM, we have a per room cost. Our care platform, our Wi-Fi, and some of the technology companies approaching me, They're asking, they're like, put this in, it's going to prevent falls, it's going to extend length of stay, but it's 5x what we pay for Wi-Fi. And if I can't sell Wi-Fi in, like none of this will work. From an ROI perspective, it's like cost per room, cumulative of the technologies. And then how does that translate to 1 extra month, 2 extra months, 3 extra months? Is it moving the needle on resident satisfaction? We do both employee satisfaction surveys and resident satisfaction surveys twice a year. And, those numbers have to stay the same and improve. So if we are negatively impacting those numbers, like we've got a mismatch of technology that we put in a community.
Yeah, I love that, Chris. That was awesome. And I think, since you touched on that financial piece of it, just even looking at the things that we can't put on a spreadsheet. So, the call that didn't happen for that family member at 2 a.m., the family didn't have to get on a plane to come in for that emergency, or even the person that got just 6 more months of independence that they didn't have. And while we can't capture those on spreadsheets, so we're looking at everything Chris said, but like we're going to feel that and we're going to see it in our retention numbers. So that really helps us out from that standpoint.
Great. Chris, the next one I think will go to you. I know you talked a little bit about how the Caring Center is helping you all scale your staff. Can you dig a little deeper and get specific around how that's working?
Yeah. So just numbers wise, and on the assisted living side, we have to respond to emergency calls within 8 to 10 minutes. So somebody physically has to go to the room. On the IL side, we're having 10-second answer rates by the Best Buy contact center. So that is significant. That is within 10 seconds of hitting that pendant, somebody greets you as Chris Nall. They know you're calling from Atria, Louisville. They know, potentially what that escalation is, and they can serve as that first level of response to know, do I need to call the general manager in the middle of the night? Do I need to call a doctor? Do I need to call a loved one? Or is it just a case of somebody wanted to talk to somebody, or somebody is worried or scared? And that scale has helped us because some of these buildings, overnight staff is very, minimum, sometimes it's even none, depending on the level of independent living that we have. And that's I can't easily quantify that, but having visited the center in Carlsbad, I mean it's a large operation supporting thousands of people, and the ability to like leverage that where we do have this gap in coverage is something that's money well spent, at least on the Atria side.
And Lauren, I don't know if you have anything to add about the Caring Center and how you're all seeing that as
Yeah,
well.
I know we might have more questions. So
Okay.
yeah,
Well,
I think
yeah, we have time for one more and then we'll close things out. So this one I think can go to both of you. I mean, you've mentioned sensors, you've mentioned ambient monitoring. The good thing is that these technologies don't require the resident to do anything. I think, Lauren, you mentioned that. But where this person is saying they're seeing a lot of concern from residents about the intrusiveness of it, and so, or how it feels intrusive. Can you talk a little bit about how you address that at your organization?
Yeah, I think we talked about it a little bit, but just talking about again, what are the benefits of it? And it's a continual conversation. It doesn't have to be, if they decide, hey, I don't want this, that's okay too. That is something that we have those conversations. They don't have to have something. I think we've had instances where we said, yes, absolutely, that's your right. And very quickly they're like seeing their neighbor like, oh my gosh, they're getting this, they're doing that. There's a little bit more freedom. And so I think that's part of the ever going conversation. You don't have to just say, here's your consent form, sign it, yes, no, and we move on. So really talking about what are the benefits to them, and are those benefits to them? They may not be, but we continue to evolve with them.
Similar to Warren, I think she hit it on the head. Is like it's a you don't have us sign the consent form. It's part of the, actually I would say, an extension of the sales process, because we deep down we want them to have it. We want them to have the pendant. We want them to, whether it's an um, or even the Wi-Fi technology. I mean, it's for them to create this, digital ecosystem that protects them. It takes, better care, and it lets more of us know. We talked a lot about the AI aspect. It gives us those insights that we can enhance the, both culinary experience, engagement experience, and the safety net around our residents, leveraging those technologies that are readily available this year.
Wonderful. Well, I know we're just at time. I want to thank everyone for joining us. I'm going to throw it back to Chris and Lauren. Any parting words before we close things out here? I want to thank you both for joining us today.
Just thank you so much for having us. I love this partnership. I love that you guys are thinking about the same things. Chris and I and Adrian Arrow are all looking at. I know everybody else out there. So, just be open and always look at what can it do for you on the other side.
Great.
Now, I love that last part about Warren. We're every time, and if I would leave people with things to do differently, get out to communities, spend multiple days just observing, walking the staff, putting yourself in not only the resident's chair, but like the staff's chair. Various different roles. I mean, that's one of the biggest scouting that I do when I go to communities is not only to make sure, okay, number one, everything's working as designed, but the second one is really what more would they ask for? Because they, I like to learn their problems. I like to love their problems, and then my team can come back with the right technology solutions. But the more time you spend in the because it is their home, I think that's different from a hotel. You really start to see these opportunities to give them a more fulfilling life when they're aging in place with us.
Such great points, and I think a really good place to end it today. Thank you all on the line for joining. Thank you to Chris and Lauren and Amanda for a great conversation. Like I mentioned, we'll be sending the recording out. Please fill out the post-survey webinar, survey for us so we can get your feedback. But really want to thank everyone and have a great day.
Thank you, Beth. Thanks, Amanda. Thank you,
Thanks.
Lauren.
Thank you.